Brock, I'd like for you to speak a little bit to the special needs of a young adult who has someone in their family that's been diagnosed with cancer.
It's a unique one. I come from that vantage point, having a mother and then a best friend, so not my family, but extended family. And we are, I think, a little bit unique in the young adult space where we're not just with patients and survivors. And they're difficult and challenging. The needs vary. And we as an organization try to provide, what we found is this concept of giving support and getting support is a rich one. And bringing together survivors and patients with folks that have a loved one with it is a rewarding experience. We haven't done research on it to quantify what it means, but it's helpful to both. And so we facilitate a lot of opportunities where they can make those connections and benefit from each other. So someone that's dealing with a breast cancer diagnosis can be paired up with a young man who's maybe his mom's going through that same journey and can say, I know what your mom's dealing with, and this is why she's not happy today, and why she's angry you didn't do your homework, or whatever it might be. And so we try to facilitate a lot of those, and we're just finding they're just tremendously rich and enhancing to the community.
Well, and just to the point of resources, I'll mention that the cancer support community, the space that we do fill for young adults is for the young adult who has a family member with cancer. So both in our affiliate centers and online, we provide support services through licensed mental health professionals. So it's a little bit different than what you do, but we feel like together we can maybe help a few people in that space. So I'd like to ask a question that comes up all the time. How old do you have to be, and where does it stop to be considered a part of the young adult survivor movement? When does it start? When does it stop?
I think the American system has chosen 15 to 39. And if you really understand why we have issues with our European counterparts or Australia, because they took the upper limit to be around 24. So when you talk about adolescent young adult cancers in other parts of the world, it stops at a much younger age. In America, we took it to 39 based on some epidemiological data and obviously some psychosocial data. The joke, 40 is the new 30. Yeah. But the reality is we say you're part of the movement at the time you're diagnosed. Your survivorship, as we're learning from the childhood cancer survivor studies, needs to continue in your lifetime, your whole lifetime, because there are long-term consequences of that. But it is funny, my patients come, suddenly there's a 42-year-old at the hospital and they say, Dr. Sen, they want to see you because they're a young adult and they want to come to see you. So I think it's creeping, so who knows, maybe it'll be. and if you look at the young adult breast cancer movement, it goes to 45. So I don't know if it's creeping.
The gap of improvement in survival rates really drops off during that time, and it sort of levels off at 15 and it levels off at 39.
At the end of the day, for you as an individual patient, you need to go where the best care is going to be, where the experts who know more about your tumor than anybody else are. And when people call and say, well, should I go see so-and-so? And so is my answer, and regardless of your age, which is who knows the most about what you have and will be best able to care for you and give you the best prognosis, if you will.
So now I'm going to ask the more controversial question. Right? What if you have the 50-year-old or you have the 45-year-old who says, I want to play? What if they want to come to the CancerCon next year and they're 46?
We don't want to stop people coming. We think that there are lessons learned and there are things to be done. I think it's a question of what they're contributing, and we want to get their contribution. So that's the whole beauty of the movement, is saying, if you're a survivor, what tips do you have for the next person coming along? What are the obstacles that you overcame? How did that help? How did you get around the institution or the insurance or the financial toxicity criteria that happened?
Last Friday, I gave a talk to a large group, and we had a Q&A around the room, and a lady stood up, Doris Johnson. She was 88 years old, and she said, I was diagnosed with cancer at 21. I'm 67 years survivor, and they took all my insides out, and the Ulman Cancer Fund and organizations like that weren't around then. And she's going to be speaking to groups. We're taking her on the road. I mean, she wants to speak. She's a whippersnapper, but what better person to deliver that message and get the attention of anyone? So absolutely, I think they deserve a seat at the table.